He may even identify himself with it and believe that he is what he appears to be.
Welcome to the NCE Study Guide. I created this study guide using ChatGPT and Notebook LM. So think of these modules as AI-powered audio flashcards. Each one of these 20 modules contains 10 mock questions representing the kind of questions that you might encounter on the National Counseling exam. I created this primarily for myself, and I decided to make these available to anyone else who might benefit from this kind of study aid. But please note, while I have done my best to ensure that these modules align with NCE content, I encourage you to cross-reference them with trusted study guides and resources for the most accurate preparation. These modules are not affiliated with or endorsed by the NBCC or any official licensing board. And today I'm introducing a new case study module. Now, as you may already know, I took the NCE and I passed it a few weeks ago, but I learned so much from putting these modules together, and I enjoy seeing the downloads increase and hearing from listeners who reach out. So I've decided to take this case study approach to kind of bridge that gap between prepping for the NCE and really getting started as a mental health care professional in the field, really understanding the ethics and the different modalities and the interventions and how would I do a diagnosis for certain situations. So that's what you're going to be hearing in these case study modules. And I also want to remind you that I'm putting together a grassroots study group for anyone who is looking for some real life person interaction as you prep for the NCE, not just these AI puppet shows. So if you're interested, email me at ncestudyguide@gmail.com. So, with no further ado, here are your AI study buddies from Notebook LM. Enjoy.
Nice to be in orbit.
Welcome to this deep dive. And this one's really geared towards you, especially if you're getting ready for the NCE.
That's right. We're looking at what we've called Case Study Module 10 of 10.
Yeah, the final one in this particular series. And the whole idea is to help you really navigate the kinds of scenarios, the clinical situations you'll see on the National Counselor Examination.
Exactly. It's all about bridging that gap, between the books and the real world. These modules are designed to sharpen your thinking on, ethical decision-making.
Right, that's huge.
Applying theory, planning treatment, basically effective ethical practice, getting you ready.
And this whole NCE Study Guide series, it comes from Glenn Osland. He recently passed the NCE himself, so this is fresh.
Yeah, and he's got an interesting background. Master's degrees in folklore and clinical mental health counseling. Plus, he's been podcasting since, 2010?
A long time. And apparently his own NCE prep journey kind of sparked this whole thing. He saw a need for practical research stuff.
Mm-hmm. Materials that actually felt like the exam questions, tackling those complexities. It came from his own need to really get it.
No, this is where it gets kind of cool, his method. He calls it the AI puppet show.
Right. It sounds a bit quirky, but it's actually quite smart. He uses ChatGPT almost like a collaborator.
Uh-huh. To help write and refine the case studies.
Exactly. To explore different angles, look at theories, research ethics, really push the thinking.
Okay, so ChatGPT helps generate and refine the core ideas. Then what?
Then he compiles all that material, organizes it in Google Docs, and feeds it into Notebook LM.
Ah, another AI tool.
Yeah, and Notebook LM acts like a synthesizer. Based on Glenn's instructions, it can take all that information and explore it, summarize it, look at it from different viewpoints.
So the end result isn't just a static case study, it's more dynamic.
Precisely. It creates this kind of dialogue-rich learning experience. It really mimics the critical thinking you need for the NCE, looking at a problem from multiple angles.
That makes sense. It's like having a built-in sparring partner for the ideas.
Which is so valuable for NCE prep, understanding those nuances.
And if listeners want to take this even further, Glenn actually runs a weekly study group.
Oh yeah, that's great.
Yeah, it's open to anyone using these materials. If you're interested, just shoot an email to ncestudyguide@gmail.com.
Good resource.
And they're also looking for feedback, like if you have a topic or a type of case study you want covered, let them know.
That's smart too. Engaging actively, suggesting topics, it really cements the learning for the exam.
Okay, let's dive into this module's case study then. It's case study 010, Maya, the young girl with big worries.
Right, so Maya is 8 years old, referred for school counseling.
And the main issues, school refusal is a big one.
Mm-hmm. Along with somatic complaints, stomach aches, headaches, and pretty clear separation anxiety.
The details mention she's tearful, clingy in the mornings, sometimes even hides before school.
Yeah, that sounds intense. And even when she gets to school, she's quiet, often wants to see the nurse.
Tough situation. What about her family?
Lives with her mother and stepfather. Her biological dad is described as inconsistent canceled visits, that sort of thing.
Okay, that could definitely be a factor. And Maya herself.
She's reported having bad dreams and specifically worries about her mom's safety while she's away at school.
Okay, that really points towards the separation anxiety piece.
Exactly. And the history notes are important here for the NCE context. No disclosed trauma or abuse, no prior mental health treatment.
She's an only child.
Yes, and the family recently moved. She changed schools.
Major life changes.
Big ones. Academically, she's capable, but grades are slipping, likely due to absences. Mom's supportive, but understandably overwhelmed.
Okay, quite a picture. Let's break it down NCE style. First section, ethical considerations. This maps to ethics and human development on the exam. Point A is informed consent and assent.
Crucial with minors. You absolutely need informed consent from the parents or legal guardians. That's the legal bit.
But assent is different, right?
Yes. Ethically, you also need Maya's assent. That means explaining therapy in a way an 8-year-old can understand and getting her agreement to participate. It respects her, even as a child.
Got it. Consent from parents, assent from the child. Next, B, confidentiality with minors. Always tricky.
Always. You have to explain the limits clearly up front to both Maya and her mom. Build trust by assuring Maya her stuff is mostly private.
Mostly.
But also explaining that if she talks about harm to herself or others, or if someone's harming her, you have a duty to share that, to keep her safe. It's that balance.
Yeah, transparency is key there. C is developmentally appropriate practice.
Seems obvious, but vital for the NCE. Using language Maya understands, using tools like play or art, not just talking like you would with an adult, tailoring everything to her age.
Makes sense. Like deep philosophical discussions probably aren't the way to go here.
Probably not. And finally, D, family and systems sensitivity.
Right, she doesn't exist in a vacuum.
Exactly. You need to involve the caregivers, understand their roles, the family dynamics, but still respect Maya's perspective. Consider attachment, those environmental stressors like the move, the dad's inconsistency. It all fits together.
Okay, that covers ethics. Let's move to section 2. Assessment and diagnosis. This lines up with appraisal, diagnosis, development on the NCE. What assessment tools are suggested?
Well, one key one mentioned is the scared screen for child anxiety-related disorders.
Sure, okay.
It's a good tool for teasing out different types of anxiety symptoms in kids. Helps with pinpointing the main issue.
And the BASC-3, Behavior Assessment System for Children.
Yes. Specifically the parent and teacher forms.
Yeah.
Getting perspectives from different settings, home and school, is really valuable for a full picture. Multi-informant assessment.
Good point. What else?
Don't underestimate direct observation, especially through play. Using a dollhouse, drawing. Kids express so much non-verbally.
Yeah, watching how they play can tell you a lot.
For sure. And of course, a solid clinical interview with both Maya and her mom is essential. History, symptoms, their views.
Okay, so gathering all that info, what's the likely diagnosis based on the DSM-5-TR?
The primary diagnosis strongly suggested here is separation anxiety disorder.
Makes sense, given the core symptoms.
Right. The intense distress about separation, the worry about mom's safety, the school refusal, the physical symptoms tied to separation. It fits the criteria well.
But we also need to think about rule-outs, right? Differential diagnosis is important for the NCE.
Absolutely. Generalized anxiety disorder is one.
Yeah.
Does she worry excessively about lots of things, or is it mainly separation? Here it seems focused.
Okay, what else?
Adjustment disorder with anxiety related to the move and school change. Possible, but the symptoms seem maybe more intense and persistent than typical adjustment.
Right. And PTSD.
It's mentioned as a rule-out. Even with no disclosed trauma, you keep it in the back of your mind, stay vigilant, especially with kids. But based only on the info given, separation anxiety is the front runner.
So the formulation insight really pulls it together. Classic separation anxiety symptoms, likely kicked up a notch by the recent stressors.
Exactly. The move, new school, inconsistent dad, those are likely exacerbating factors acting on an underlying vulnerability.
Which leads us nicely into section 3, theoretical approaches. This links to theories and family counseling on the NCE. First up is play therapy, specifically child-centered.
Yeah, a really good fit for an 8-year-old. Play is their natural way of communicating and processing things.
So child-centered means you let Maya lead.
Pretty much. You create a safe space, build trust, and follow her lead in the play. It helps her express feelings, work through stuff, build coping skills, all through play.
Okay. Next approach, CBT for children.
Cognitive behavioral therapy, but adapted. It's very common for anxiety, so definitely know this for the NCE.
How is it adapted?
It involves helping Maya identify those worry thoughts, challenge them in age-appropriate ways, learn concrete coping skills like relaxation, and then gradually face feared situations like school through exposure.
Exposure, okay. Like tiny steps towards going back to school.
Exactly. Step-by-step, manageable challenges.
And the third approach mentioned is a family systems approach.
Crucial here, because Maya's anxiety impacts the whole family, and family patterns might, unintentionally be keeping the anxiety going.
How so?
Like if parents give in to the school refusal every time, it reinforces the avoidance. So family systems looks at those interaction patterns, communication, parental rules involving the family is key to lasting change.
Got it. That flows right into Section 4, interventions. Connecting to helping relationships and child work on the NCE, the guide breaks it down into phases. Early phase.
Build rapport. That's number one. Use play, art, sandbox, whatever helps Maya feel safe and connected.
And start introducing some tools.
Gently, yes. Maybe simple CBT stuff like worry monsters, giving the worry a physical form she can manage, or basic breathing exercises, positive self-talk phrases.
Concrete things she can grab onto.
Exactly. And the guide mentions developing a daily goodbye ritual with the caregiver.
Ah, like a special handshake you're saying? For predictability.
Predictability and connection. Reduces uncertainty around separation.
Okay, then the middle phase. What happens there?
More direct work on the anxiety. This is where that gradual exposure plan comes in.
The small steps towards school.
Yes. Maybe just driving past the school, then walking to the door, then staying for 15 minutes, building up slowly. Needs careful planning with Maya and her mom.
And the feelings thermometer. What's that?
It's a visual tool. Helps kids rate how strong their feelings are, like anxiety on a scale, maybe 1 to 10, or using colors or faces. Helps them understand and communicate their internal state.
Makes it less abstract.
Right. And family sessions continue to be important in this phase.
Focusing on
aligning parenting strategies, making sure everyone's on the same page, reducing that unintentional reinforcement of avoidance we talked about, supporting the parents too.
Makes sense. What about psychoeducation? What topics are helpful?
Educating Maya and her mom about anxiety in kids, what it is, how it affects the brain and body, and giving parents concrete strategies for fostering independence and managing those tough moments.
Empowering them with knowledge. So how do we know if any of this is working? Indicators of progress.
You look for observable changes. Is she going to school more often?
Okay. Attendance?
Fewer visits to the nurse, fewer stomach aches reported. Is she starting to use those coping skills like deep breathing on her own?
Right, applying the tools.
And generally just seeming more emotionally open, more confident, separating more easily. Those are all good signs.
Okay, great. That brings us to the final content section before the questions. Section 5, key takeaways for the NCE. Kind of summarizing the essentials from Maya's case.
First, always remember those unique developmental and ethical factors with kids' consent and assent, developmentally appropriate methods, the nuances of confidentiality.
Second, being able to accurately assess and diagnose things like separation anxiety, knowing the criteria, ruling out others.
Third, knowing how and when to apply specific therapies like play therapy and child-adapted CBT for anxiety, understanding the why behind them.
Fourth, the importance of that family systems lens, seeing the child in context, involving caregivers effectively.
And finally, using multi-informant assessment, getting info from parents, teachers, the child, and the value of collaborating with a school. It takes a village sometimes.
Definitely. Okay, that's a solid review. Now let's really lock this in with some NCE-style questions based on Maya's case. Ready?
Let's do it. Great practice for the exam.
Question 1. What is the most appropriate diagnosis for Maya based on the case? Options are A, generalized anxiety disorder, B, PTSD, C, separation anxiety disorder, D, adjustment disorder with mixed features.
Okay, so the core question is, given everything we know about Maya, what's the best diagnostic fit?
And the answer is C, separation anxiety disorder.
Right. The rationale is that her primary symptoms, the intense fear around separation from mom, the worry about mom's safety, the school refusal tied to this, the physical symptoms, they all line up really strongly with the specific criteria for separation anxiety disorder in the DSM-5-TR. The focus is clearly on separation.
Makes sense. Question 2. Which assessment tool is developmentally appropriate to assess child anxiety symptoms? Choices: APHQ-9, Be Scared, C, MMPI-2, D, BDI-2.
So which one of these is actually designed for kids and anxiety?
That would be scared.
Exactly. The screen for child anxiety-related disorders is specifically developed and validated for children and adolescents. The others, PHQ-9 for depression, MMPI-2 for adult personality psychopathology, BDI-2 for adult depression, they're just not the right tools for an 8-year-old's anxiety.
Good distinction. Question 3. What ethical step is necessary when working with Maya as a minor client? Options. A. Only seek parental consent. B. Have Maya sign her own HAPA release. C. Obtain parental consent and Maya's assent. D. Wait until age 12 for therapy to begin.
Okay, thinking ethically, what absolutely needs to happen when starting therapy with Maya?
The answer is C. Obtain parental consent and Maya's assent.
Correct. You need the legal okay from the parents, consent. But ethically, you also need to involve Maya in the decision in an age-appropriate way. Assent. Just getting parental consent isn't enough ethically. Maya signing HIPAA isn't right, and there's no arbitrary age minimum like 12.
Clear. Question 4. Maya draws a picture of her mother getting hurt while she's at school. What is the best clinical response? Options. A. Assume it's just imagination. Conduct a gentle check-in and assess for anxiety content. C. Report immediately to Child Protective Services. D. Ask her to stop drawing such upsetting things.
So Maya draws this concerning picture. What's your first move as the therapist?
The best initial response is B. Conduct a gentle check-in and assess for anxiety content.
Right. You don't jump to conclusions. You explore it gently. Tell me about your picture. It's likely related to her separation anxiety and fears about her mom's safety. Dismissing it, A, overreacting without more info, C, or shutting down her expression, D, are all less therapeutic.
Makes sense? Explore first. Question 5. A key CBT technique to use with a child experiencing anxiety is A. Free association. B. Worry monster activity. C. Challenging existential dread. D. Narrative reauthoring.
Which of these fits best under the umbrella of child-friendly CBT for anxiety?
That would be B. Worry monster activity.
Yep, is a concrete, developmentally appropriate CBT technique for externalizing and managing worries. Free association is psychodynamic. Existential dread is usually too abstract for this age. Narrative work is often more complex. Worry monsters are right in the CBT for kids toolbox.
Okay. Question 6. The central goal of family systems work in Maya's case is to A. Interpret parental dreams. B. Reduce family involvement. C. Align parenting responses and reduce reinforcement of avoidance. D. Diagnose the parents.
Thinking about the family systems angle, what's a primary objective?
The answer is C. Align parenting responses and reduce reinforcement of avoidance.
Exactly. You want to help the parents work together consistently, support Maya, and stop unintentionally rewarding the avoidance behavior, like letting her stay home easily. It's about changing the system's response patterns, not interpreting dreams or diagnosing parents in this context.
Got it. Question 7. Which of the following is an example of Maya using a learned coping skill? A. Hiding from her mother. B. Asking to stay home from school. C. Practicing deep breathing before school. D. Refusing to talk during sessions.
Which action shows Maya is actually applying something she learned in therapy to manage her feelings?
That's C. Practicing deep breathing before school.
Right. That's an active coping strategy, self-regulation. The others, hiding, asking to stay home, refusing to talk, are generally signs of distress or avoidance, not adaptive coping.
Makes sense. Question 8. Which ethical principle is most relevant when respecting Maya's need for privacy in sessions while involving her caregiver? A. Fidelity. B. Autonomy. C. Confidentiality with limits for minors. D. Beneficence only for parents.
This gets back to that tricky balance. Which ethical principle directly addresses the privacy versus parental involvement issue with kids?
It's C. Confidentiality with limits for minor.
Precisely. This principle captures that specific tension. The child's right to privacy isn't absolute, and it needs to be balanced with the need for safety and appropriate caregiver involvement. Fidelity, trustworthiness, and autonomy, self-rule, are relevant generally, but C is the most specific principle here.
Okay. Question 9. What would indicate that play therapy is helping Maya process her anxiety? A. She becomes more withdrawn. B. She starts engaging in repetitive aggressive play. C. She creates stories about overcoming scary situations. D. She stops wanting to play altogether.
What kind of play suggests therapeutic progress is happening?
That would be C. She creates stories about overcoming scary situations.
Yes. When kids start using play symbolically to work through fears, create mastery narratives, that's a great sign they're processing the anxiety. Increased withdrawal, repetitive aggression without resolution, or stopping play often indicate ongoing distress or disengagement.
Last question, number 10. Which of the following is a likely contributing factor to Maya's anxiety? A, high test scores, B, a recent school change and inconsistent paternal involvement, C, excellent social skills, D, strong paternal support.
Looking back at her history, what likely contributed to her current anxiety?
The answer is B, a recent school change and an inconsistent parental involvement.
Exactly. These are significant stressors that disrupt a child's sense of security and predictability, making them more vulnerable to anxiety. The other options, high scores, good social skills, strong support, would typically be seen as protective factors, not risk factors.
Okay, fantastic. That really helps walk through how these concepts apply. And just one more reminder about that weekly study group Glenn Ostland hosts.
Yeah, great resource for NCE prep.
If you want to join or get more info, email ncstudyguide@gmail.com and do send them any ideas for future case studies or topics you'd find helpful.
Definitely. And maybe something to think about as you wrap up this deep dive. Consider how that interplay we saw with Maya, her individual vulnerabilities and those environmental stressors like the move or family issues, shapes a child's anxiety. What other kinds of life transitions might trigger similar responses in kids?
That's a great question to ponder, thinking beyond this specific case.
How might different stressors manifest?
Well, thank you so much for joining us for this deep dive focused on Maya's case and NCE preparation. We really hope this has been valuable for your studies.
1, 2, 3.
Nice to be in orbit.